Cholesterol blood test explained. What you need to know about the lipid panel. A cholesterol blood test, often referred to as a lipid panel, is a vital tool used by healthcare professionals to evaluate your risk of cardiovascular disease. This test measures the levels of cholesterol and other fats, or lipids, in your bloodstream. Understanding your cholesterol numbers can help you take proactive steps to protect your heart health. How often should you get tested? The Centers for Disease Control and Prevention, CDC, recommends that healthy adults undergo cholesterol testing every 4 to 6 years. However, individuals with certain risk factors, such as a family history of high cholesterol, obesity, diabetes, or smoking, may need to be tested more frequently. Cholesterol screening often begins in childhood or adolescence, with regular monitoring starting at age 20 and continuing at least every 5 years thereafter. Why cholesterol matters? Cholesterol is a waxy, fat-like substance found in all the cells of your body. It plays a crucial role in the production of hormones, vitamin D, and substances that help digest foods. While some cholesterol is essential for good health, elevated cholesterol levels can lead to serious health risks, including heart disease, atherosclerosis, the hardening or narrowing of arteries due to plaque buildup. What does a lipid panel measure? A complete lipid profile measures several types of fat in your blood, providing a comprehensive picture of your cardiovascular risk. The main components include 1. High-density lipoprotein, HDL, cholesterol. Known as good cholesterol, HDL helps remove excess LDL cholesterol from the bloodstream. Higher HDL levels are associated with a lower risk of heart disease. 2. Low-density lipoprotein, LDL, cholesterol. Often labeled as bad cholesterol, LDL can accumulate on artery walls, contributing to blockages that may result in heart attacks or strokes. Lowering LDL levels is a primary target in cardiovascular disease prevention. 3. Triglycerides. These are a type of fat that the body produces from excess calories, especially from sugar and alcohol. Elevated triglyceride levels are linked to an increased risk of heart disease, particularly when combined with high LDL or low HDL cholesterol. 4. Very low-density lipoprotein, VLDL, cholesterol. VLDL carries triglycerides through the bloodstream. Although it is not typically measured directly, its levels are estimated as 20% of your triglyceride value. While VLDL is not used to guide treatment decisions, it is still considered a factor in cardiovascular risk. 5. Total cholesterol. This is the sum of HDL, LDL, and VLDL cholesterol. It reflects the overall cholesterol content in your blood. Among these, total cholesterol and HDL cholesterol are directly measured in lab tests. LDL and VLDL are calculated based on the total cholesterol, HDL, and triglyceride levels. What's considered a normal cholesterol range? In the United States, cholesterol and triglyceride levels are typically measured in milligrams per deciliter, mg/dl, of blood. Understanding what these numbers mean can help you and your healthcare provider interpret your test results accurately. Ideal cholesterol levels for most adults are as follows. LDL, low-density lipoprotein, cholesterol, less than 100 milligrams per deciliter. HDL, high-density lipoprotein, cholesterol, between 40 and 60 milligrams per deciliter. Higher levels are considered protective. Total cholesterol, less than 200 milligrams per deciliter. Triglycerides, less than 150 milligrams per deciliter. VLDL, very low-density lipoprotein, cholesterol, less than 30 milligrams per deciliter. If your results fall outside of these reference ranges, your risk of developing conditions such as heart disease, stroke, or atherosclerosis may be elevated. However, cholesterol levels are just one part of the picture. Your healthcare provider will also assess family history of cardiovascular disease, body weight and BMI, physical activity levels, diet, smoking status, and alcohol consumption. Other existing medical conditions, e.g., diabetes, hypertension. When additional testing may be needed, abnormal cholesterol results may prompt further diagnostic testing. For example, a blood glucose test may be ordered to evaluate for diabetes, which can be closely linked with abnormal lipid levels. A thyroid function test may be performed to assess for hypothyroidism, a condition that can contribute to elevated cholesterol. Can cholesterol test results be inaccurate? While lipid panels are generally reliable, several factors can influence the accuracy of test results. Improper fasting before the test. Medications that affect lipid levels. Recent illness, dehydration, or acute stress. Human or lab error. In addition, the formula used to estimate VLDL cholesterol assumes that VLDL equals 20% of your triglyceride level. However, this estimation becomes less accurate when triglyceride levels exceed 400 mg per deciliter, potentially leading to misleading results. To improve accuracy, healthcare providers typically evaluate both HDL and LDL cholesterol, rather than relying on LDL alone. Who should have a cholesterol test? A cholesterol blood test is not just for older adults or those already diagnosed with heart disease. Routine cholesterol screening plays a critical role in early detection and prevention of cardiovascular conditions, even in seemingly healthy individuals. You should strongly consider getting tested if you have a family history of high cholesterol or premature heart disease, are overweight or obese, smoke cigarettes, drink alcohol frequently, led a sedentary lifestyle, have a diagnosed medical condition such as diabetes, kidney disease, polycystic ovary syndrome, POS, hypothyroidism, underactive thyroid. Even if you don't have obvious risk factors, the Centers for Disease Control and Prevention, CDC, recommends cholesterol testing for most healthy adults every 4 to 6 years. Cholesterol testing for children and adolescents. Cardiovascular risk can begin early in life. For this reason, the CDC also advises that cholesterol levels be checked once between ages 9 and 11, again between ages 17 and 21. Earlier or more frequent testing may be recommended for children with obesity, diabetes, or a family history of elevated cholesterol or early heart disease. Preparing for a cholesterol blood test. Depending on your medical history and specific test, your doctor may recommend fasting prior to the test. In general, fasting involves avoiding all food and drink, except water, for 9 to 12 hours before your blood is drawn. Fasting is typically required for more accurate triglyceride and LDL cholesterol readings. However, updated 2018 guidelines from the Journal of the American College of Cardiology state that non-fasting lipid tests are also reliable for most adults over age 20 who are not currently taking lipid-lowering medications. Your healthcare provider will determine whether fasting is necessary based on your health profile. Before your test, be sure to inform your provider about any symptoms or health conditions you are experiencing, your family history of heart disease or cholesterol problems, all medications, vitamins, or supplements you are currently taking. Some medications, such as oral contraceptives, corticosteroids, or certain psychiatric drugs, may impact your cholesterol levels. If necessary, your doctor might advise you to pause these medications a few days prior to testing. How is a cholesterol test performed? A cholesterol test is a standard outpatient blood draw, commonly done in the morning, especially if fasting is required. The procedure is straightforward. A healthcare professional will draw a blood sample, usually from a vein in your arm. The process typically takes less than 5 minutes. You may feel a quick pinch at the puncture site and occasionally mild soreness afterward. Cholesterol testing is available in various settings. Diagnostic labs or clinics, $50 to $100. Local pharmacies, $5 to $25, usually for basic non-lab tests. At-home test kits, $15 to $25 for basic results, or $75 to $200 for lab-processed mail-in kits. If your cholesterol test is ordered by a healthcare provider, it is often fully or partially covered by insurance. Are there any risks? Cholesterol testing is very safe. However, as with any blood draw, there are minimal risks, which may include mild pain, bruising, or soreness at the site of the blood draw, feeling slightly lightheaded, rarely, a minor infection at the puncture site. These effects are typically short-lived and resolve on their own. Are home cholesterol tests reliable? At-home cholesterol test kits offer a convenient way to check your lipid levels, but their reliability can vary significantly depending on the brand and how well the test instructions are followed. A 2017 study found that 2 point-of-care lipid testing devices delivered results that were relatively close to those from standard laboratory testing. HDL cholesterol results were accurate within 12% of lab results. Total cholesterol was within 10%. Triglycerides were within 15%. However, a 2021 study evaluating 5 commercial home cholesterol tests revealed inconsistent performance. While the Roche Accutron Plus showed excellent accuracy, other devices had poor diagnostic reliability. Researchers emphasized the need for stricter regulation and standardization in the home testing market. Bottom line, home cholesterol tests can provide a general indication of your lipid levels, but they are not a substitute for professional laboratory testing, especially if you have risk factors for high cholesterol or cardiovascular disease. For the most accurate and actionable results, consult your healthcare provider. Lifestyle changes and treatment for high cholesterol. If your cholesterol levels are elevated, lifestyle modification is often the first line of treatment. In many cases, these changes can significantly reduce LDL, bad cholesterol, and overall cardiovascular risk. Key strategies include: quit smoking. Smoking lowers HDL and increases your risk of heart disease. Ask your doctor for help with a structured cessation plan. Eat a heart-healthy diet. Focus on whole, unprocessed foods. Increase your intake of vegetables, fruits, whole grains, and lean proteins. Incorporate more soluble fiber from oats, legumes, fruits, and vegetables. Limit foods high in saturated fat, such as red meat, butter, cream, and palm oil. Avoid trans fats. Look out for partially hydrogenated oils on food labels and eliminate them from your diet. Exercise regularly. Aim for 150 minutes of moderate-intensity aerobic activity per week, about 22 minutes per day. Maintain a healthy weight. Losing even a small amount of weight can positively affect your cholesterol levels. Limit alcohol consumption. Excessive alcohol intake can raise triglycerides and worsen cholesterol levels. In some cases, your doctor may recommend the therapeutic lifestyle changes, TLC, diet, which involves less than 7% of daily calories from saturated fat, under 200 milligrams of cholesterol per day from food. Your doctor might also encourage you to eat more foods that help block cholesterol absorption in your digestive tract, including oats, barley, and other whole grains. Fruits such as apples, oranges, pears, and bananas. Vegetables like eggplant and okra. Beans and legumes such as lentils, chickpeas, and kidney beans. When lifestyle changes aren't enough. If diet and lifestyle modifications do not sufficiently reduce your cholesterol levels, medication may be prescribed. Common options include statins, the most commonly used drugs to lower LDL cholesterol. Other lipid-lowering agents such as ezetimibe, PCSK9 inhibitors, or bile acid sequestrants, depending on your condition and risk profile. Your healthcare provider will determine the most appropriate course of treatment based on your overall cardiovascular risk. The bottom line: a cholesterol blood test is a valuable diagnostic tool used to measure the levels of cholesterol and other fats in your bloodstream. This information helps healthcare professionals assess your risk for cardiovascular diseases, including heart attack, stroke, and atherosclerosis. For most healthy adults, cholesterol screening should be performed at least once every 5 years. However, individuals with a family history of high cholesterol or other risk factors, such as obesity, smoking, diabetes, or an inactive lifestyle, may need to be tested more frequently. If your test reveals elevated cholesterol levels, your healthcare provider will work with you to develop a personalized treatment plan aimed at reducing your cardiovascular risk. Effective treatment typically includes a combination of heart-healthy dietary changes, regular physical activity, smoking cessation, weight management, prescription medications when necessary. Monitoring and managing your cholesterol is a critical step in protecting your long-term heart health. By staying informed and proactive, you can reduce your risk of serious cardiovascular complications.